Addressing HIV and keeping people healthy and preventing a decline in their immune system with early antiretroviral therapy soon after diagnosis, you can really dramatically reduce the incidence of active tuberculosis, which will in turn reduce transmission, from person to person, et cetera. So I think addressing HIV can really tackle tuberculosis in a big way. But it's certainly not the only solution, and I think approaches to tuberculosis can also dramatically help outcomes in HIV-infected people. We know that people are often living with their HIV, but then dying of tuberculosis despite being on antiretroviral therapy. So I think a dual approach, an integrated approach offer a lot of promise, and that really it'll be difficult to address HIV in settings with a high burden of TB without also concomitantly addressing tuberculosis. One area that I'm actively interested in my research is understanding more about how tuberculosis is transmitted in settings with really high burdens of both HIV and TB. I think much of what we understand about tuberculosis transmission dynamics are based on community-based epidemiologic studies and molecular epidemiologic studies, which use some techniques to try to understand if one person's tuberculosis is the same as another's and how they relate. A lot of our understanding of TB transmission is from places like San Francisco, New York, it really developed in Europe, but really from the developed world. I think there's a lot of research that needs to be done in settings with generalized HIV epidemics and see how that changes. So one of my active research projects is looking at tuberculosis transmission dynamics in a rural East African setting in Uganda, and trying to understand how people are transmitting to one another. Are there high-risk locations? What's the contribution of transmission of tuberculosis due to home-based transmission versus clinic-based versus out in the community? And I think answering some of those questions really can serve as a basis for novel public health approaches to addressing both tuberculosis and HIV.